Sleeve gastrectomy, as we call it, or gastric sleeve, is a form of bariatric or weight loss surgery. Uh, at this moment, there are strict guidelines when we can offer this type of surgery in the United Kingdom. The BMI has to be above 35 with comorbidities like diabetes mellitus, high blood pressure, sleep apnea, or osteoarthritis. However, there are certain relaxations in this criteria if somebody is from the subcontinent or the Asian heritage. If the BMI reaches more than 40, then associated conditions are not required. Sleeve gastrectomy is a weight loss procedure. It is the most common weight loss procedure worldwide now. It provides significant weight loss, which is also sustained long term. Gastric sleeve involves removing about 3/4 of the stomach using stapling device. Just to be mindful, this is an irreversible procedure as compared to other weight loss procedures like Roux-en-Y gastric bypass or gastric band. This is effective because it provides severe restriction to begin with and can lead to about 65 to 70% of excess weight loss in 18 to 24 months. The other weight loss procedures prevalent at the moment, surgical weight loss procedures, are Roux-en-Y gastric bypass and gastric bands. Those two are also done in laparoscopic or keyhole fashion. Gastric band, the recovery is quite quick. However, there are known long-term complications, so that procedure is not preferred as much nowadays. There are certain indications where Roux-en-Y gastric bypass is preferred over a gastric sleeve, especially in a patient who has pre-existing gastroesophageal reflux or has a severe metabolic syndrome. Then I would prefer the gastric bypass to the gastric sleeve. There's another surgery called SADI or duodenal switch, which is less commonly performed in the UK. This is the second stage of gastric sleeve in super obese patients. The preparation is paramount. Preparation starts with initial consultation in the clinic, then consultation again with the bariatric nurse, then consultation again with the dietitian. The key to success in this procedure is preparation, because the more you're prepared, the more likely to be successful this procedure is going to be. That is because this changes the way the patient eats and drinks and behaves as well long term. So after the initial appointment, the patient is normally put on a liver reduction diet for about 4 to 6 weeks, depending on their BMI. They are in regular consultation with the bariatric nurse and dietitian, bariatric physician, and also the anesthetist. Need to undergo blood tests and preoperative tests in order for them to prepare for the surgery. If the blood tests show certain deficiencies in vitamins, then they need to be corrected. If somebody is suspected of having sleep apnea, then that also needs to be addressed before we undertake the surgery. Gastric sleeve is very effective in reducing the weight. However, in process of reducing weight, it also is very effective in benefiting the patient who has diabetes, high blood pressure, or arthritis, or associated problems which comes with obesity. However, this process is very restrictive to begin with, and for the first 6 weeks or so, the patient is on a pure or a semi-solid diet, after which they gradually introduce solid foods, that too in smaller quantities. This second stage lasts for between 6 weeks to 2 to 3 months, and after that, gradually they introduce other kinds of food. It is paramount that the patients stick to the dietary regime and also do exercise as much as possible. So initially, after the surgery, they start walking as much as possible. After, let's say, 2 to 3 weeks post-surgery, then start introducing muscle building exercises from about 4 weeks. This is very important to build muscles so that the muscles are not lost during this phase. And also, they don't have problems of excessive skin.